As counties pass their own mask mandates, Missouri's governor continues to fight it. The St. Louis Pandemic Task Force leader says the lack of a mandate, along with no safer at home order in place, no longer makes any sense. In this afternoon's briefing, Dr. Alex Garza said, "We have not been shy in advocating for a mandatory mask mandate for the entire state. You've heard us ask the governor to do this, and for good reason." And that reason Garza refers to is local hospitals are at capacity and beds are almost full.
So SSM St. Joseph's Hospital is running an overflow tent to help meet the need. Only on 4 tonight, Emma Hogue shows us what they're calling an extension of the emergency room in Lake St. Louis.
If you come to the emergency room, you'll first go inside to get triaged, but depending on the severity of your injury or illness, they may send you back outside to this tent. That's because COVID-19 has beds so full, they're only treating high priority patients inside.
It's basically a way of us seeing patients that would generally be sitting in our waiting room.
But instead of waiting inside on a stretcher, some patients now wait inside this tent in a chair separated by 8 dividers. It's a mix of COVID-19 patients and others who need treatment but not immediate care.
The patients that don't necessarily need to go to the back, patients that we can start treatments and actually discharge straight from the tent. Takes a lot of pressure off the nurse in the back.
Nurse Connor Bortham says he's worked overtime treating patients in the tent they're now calling an extension of their emergency room.
It's not uncommon to see 20+ people in the waiting room waiting to be seen.
Today, Dr. Alex Garza with the St. Louis Pandemic Task Force witnessed 3 patients, all vying for 1 ICU bed. As cases rise, he worries what holiday gatherings and flu season will bring.
We know that we will see an additional bump in cases afterwards. We just don't know how bad it's going to be yet.
But hope is in sight. Dr. Garza says healthcare workers can expect a vaccine in the next few weeks. Those in high-risk categories can get it next, and he expects otherwise healthy individuals to get it by April or May of next year. The vaccine is a 2-shot series over a 3-week period that will be offered at a handful of locations.
The locations are going to be for the healthcare systems and then most likely some public health. As the vaccine becomes more and more available, then it'll start expanding to places like CVS or Walgreens, places like that, primary care physician offices.
But until then, doctors and nurses are trying to do the best they can with the limited resources they have.
We've all pulled together pretty good to try and do the best we can to support our staff and treat the patients that come in.
A question we're hearing a lot is if you still need to get the vaccine, if you've already had COVID-19. Well, Dr. Garza says he's still working through what advice to give in regards to that. The challenge is healthcare workers still don't know how long those antibodies last. Hopefully more clarification to come on that in the coming months. Reporting in Lake St. Louis tonight, Emma Hogue, News 4.